we're actually really, really darn good at diagnosing and treating the majority of structural problems in the body. I mean, certainly there are things that can go on with structural that we can't treat, but we're really darn good at that. But again, it's looking at these chronic symptoms that are neuroplastic, that are brain generated, and that the treatment is not in the body. Hi, I'm Becca Kennedy.
And hi, I'm Howard Schubiner.
And this is The Science Behind the Symptoms, where we explore the new science of neuroplasticity through a lens of curiosity.
And this is a podcast of the Association for the Treatment of Neuroplastic Symptoms. Today's topic is the treatment of pain, chronic pain, and other neuroplastic symptoms. And this is where it really gets interesting, wouldn't you say, Becca, when we talk about treatment is where the rubber meets the road, right?
Exactly. I mean, it's one thing to understand the new science, understand why the symptoms are there. But most of my patients, I explain that, and then they're sort of like this. And I say, now you want to know, well, what do you do about it?
Right. Yeah, I mean, before you can explain things, I mean, that's what people want to know. They want to, well, what am I going to do? How am I going to get better? What's the treatment? And is this treatment different than the other treatments? And how? So
and why does it work?
Yeah, exactly. And can you guarantee it's going to work? Right. And so
how long?
And how long is it going to take? So there's a lot of different treatments out there for chronic pain. Obviously, we're going to talk about that. There are biomedical treatments, alternative medicine treatments, psychological treatments. There's a lot of treatments out there for anxiety, depression, chronic fatigue, category of illnesses in those categories as well. And it's confusing. You're right. It's confusing to people, especially when they've tried something, didn't work, and then they're kind of on second line or plan B or plan C or plan F.
And so today will be actually a two-part podcast of the treatment. So today we're going to talk about kind of the overview, what's out there, and then we'll touch on the treatments, some of the different treatments that we use, but then we'll have another episode where we'll really explore that even more.
Right. And it's good that there are many treatments out there. You know, it's good that there are options for people because not everybody's going to respond well to one particular treatment or prefer, some people really prefer a particular treatment. I have a friend who has migraine, and I was telling her about mind-body treatments for migraine, and she said, I just want medication, okay? I just want medication for my migraine. That's what I want. And there are medications for migraine, so that's a good thing.
Yeah.
Right?
Yeah, absolutely.
But on the other hand, we see so many people who suffer needlessly, who have been through the mill, who have been through the biomedical treatments, have been through the traditional medical system, been through the alternative medical system, and still are suffering. And, to be honest, that's the vast majority of people who have neuroplastic symptoms of chronic pain, chronic anxiety, depression, chronic fatigue syndromes, that the other treatments often do not really reverse the problems.
Yeah. And I love medicine. I love prescribing medicine. I actually like taking medicine when it works and when it's safe and when it helps the problem. Medicine is fantastic for that. It's just that, like you're saying, Howard, there's so many problems that people continue to suffer despite the medicines.
And the truth is that over the past couple of decades, modern medicine has made improvements in the treatment of cancer, in the treatment of stroke, in the treatment of diabetes, in the treatment of heart disease. And a lot of those diseases are actually having decreased mortality. We're actually making inroads from modern medicine. But just because modern medicine is right about some of these new cancer treatments, it doesn't mean they're right about these kinds of neuroplastic conditions, what we call the morbidity conditions, the things that don't kill you, but cause great suffering like chronic pain, anxiety, depression, fatigue, et cetera, over time. And so, I'm thinking about people who've gotten excellent medical care. There's a guy who emailed me a while ago named Gary, and he had leg pain, and it started with just seemed like a minor injury. And over time, the pain got worse and worse and worse. And he's going to one of the top medical centers in the country, and he's getting physical therapy and injections and medications and even having surgery, and it's not getting better, and it's getting worse and worse. But the main thing is he could at least walk, but then his foot started hurting. And then he couldn't walk. And then the foot, and then he saw 20 different doctors for the leg and back pain. There's also back pain. And then he saw another 20 some doctors for the foot pain. Again, more injections, more procedures, more medications, more physical therapy, and stuck, literally stuck. And what happens when you get to that point? You consider suicide.
Yeah.
I mean, that's the amount of suffering.
It feels hopeless. And as a primary care doctor, patients would come back to me over and over after those 20 doctors with the different symptom and coming back to me asking for other answers, understandably.
Exactly. And so then I met Gary because he sent me an email. He had a physical therapist at his, top medical center, said, you know what, check out this podcast, look at the ATNS, look at what Dr. Schubiner's doing, look what Dr. Kennedy's doing, look what all these people are doing. And he starts looking at some interviews and podcasts. He starts doing some of this work. And he sent me an email that said, it's been a couple months. Thank you. You saved my life. I didn't do anything, right? I didn't do anything.
Amazing.
But it's getting this message out there. And that's what this podcast, is about, because the model that we're using is revolutionary. I mean, it is different.
Amazing. So someone who saw all these doctors, tried all of these things, and now is getting better with this information.
Right.
So
in a short time.
Treatments.
Without doing anything.
Right. Well, that's the thing is that, and this is what we'll talk about, is that these are ultimately self-management tools. So it's such a different paradigm shift. I think we're used to thinking about something is being done to us. We're taking a medicine, we're getting a procedure, getting, any one of a number of different treatments to us. But the treatment that we use is really about self-management tools that we teach you and guide you on and help you through that. But it's really found within yourself.
Right. So when we start with the standard medical treatments, we're talking about a model of treatment that's the biomedical model, biomedical technological model, which means that the pain, the other symptoms, the fatigue, anxiety, depression, insomnia, etc., is a biological problem. There must be something wrong in the body, and therefore the treatment must be strictly and purely biological, biomedical.
And again, right. And that's such an important point. Again, medical model, the standard medical model is thinking about that the generator of the symptoms is happening because of something in the body, some sort of problem in the body.
Yeah, I mean, I had my body pump class this morning, pumping up, and my teacher afterwards, I'm talking with her, a young woman, and she shows me her scar. She had an acoustic neuroma, and she had surgery, and they cured her. She doesn't have that cancer that could have killed her. That's what she needed. She needed that kind of treatment. But in our situation where we're talking about people with chronic back pain, and then the treatment is, and we talked about this last time, where because the MRI is going to be abnormal in 98% of people, the treatment will be focused on physical therapy, focused on posture, focused on medications, focused on injections. And an article just came out this month showing, with a big meta-analysis of all the injection therapies, conservative therapies for chronic back pain, showing that, guess what? They don't work. It doesn't mean they don't never work. It means they don't work better than a placebo injection. And the same is true when we think about medications for irritable bowel syndrome, diets for irritable bowel syndrome, medications for migraine, medications for anxiety, depression, chronic fatigue, long COVID. They can work, but why, when they work, the question is, are they working better than a placebo would? And how would we know?
Yeah.
The only way you know is do research.
Yeah, exactly. And again, modern medicine is fantastic at treating damage in the body. We're really good at that at this point. Infections, orthopedic injuries, cancer, metabolic problems. We're actually really, really darn good at diagnosing and treating the majority of structural problems in the body. I mean, certainly there are things that can go on with structural that we can't treat, but we're really darn good at that. But again, it's looking at these chronic symptoms that are neuroplastic, that are brain generated, and that the treatment is not in the body.
Right. And so people can go through a lot of invasive treatments that can actually be harmful, obviously, because you can have side effects when you're having major surgery, major invasive treatments. And we were talking earlier about a situation which is people have tailbone pain. Tailbone is the coccyx. And if you have tailbone pain, you can get biomedical treatment would be physical therapy, medications, injections. But, if it gets really, really bad, there are surgeons who will actually remove your coccyx, which is really an invasive and seems like a really barbaric procedure. And if you tell most people about, or remove the coccyx, like cutting off your arm because you have hand pain, which I've seen before. I had a patient who literally had an amputation below her knee because of ankle and foot pain. After 10 other surgeries, couldn't fix her pain.
And what happened? Did the pain go away?
No, she still had pain after the amputation. It's a horrible story, right?
Yeah.
And so with these coccygectomies, removing the coccyx, so I was looking up the medical literature on that, and guess what? It says, it's really good. A lot of people got better. Like in our studies, 80% of people got better after we removed their coccyx. And the problem with that is, I'm not saying they're lying. Problem with it is, question is, why did they get better? Because a similar procedure is a SI joint fusion. So the sacroiliac pain is another common cause of what people think is causing back pain. Sacroiliac joint, which is a little joint there, barely does anything, and you can operate on it. You can fuse the joint. And they've done research on that, shows it's really good. It works really well. But then a group did a study where they compared doing the SI joint fusion to sham SI joint fusion, where they operated but didn't actually fuse the joint. And the results were exactly the same. When you get better, why is that? Yeah,
so the randomized controlled trial showed that sham surgery, where they didn't actually do a real surgery, versus a real surgery, there was people improved in both groups.
Exactly.
But at the same rate.
Exactly.
So this is such an important point, because the difference is the treatments that are out there for these chronic symptoms, chronic pain, fatigue, long COVID, is body-based.
Exactly.
Medicines, procedures, surgery, all these external things. And then there's the alternative medicine people often go to, right? They want to get better. Yeah, right. And the alternative treatments are things like acupuncture, chiropractic, supplements,
homeopathy,
functional
medicine.
Right, functional medicine. So again, it's different than the mainstream medical paradigm or treatment, but it's still looking in the body for the answers. It's still treating the body, just in a different way.
Exactly. And just because modern medicine is right and is good for a lot of biomedical disorders like cancer, heart disease, etc.
Yeah.
It doesn't mean it's good for the neuroplastic disorders of these chronic pain situations, etc. Right. And just because modern medicine is not so good at these neuroplastic symptoms, it doesn't necessarily mean that alternative medicine is right.
Right. And how do we know?
And it has to be studied. Exactly.
Right. So let's look at the scientific method, because I think that this is so key of what is the placebo effect? What is a scientific study that actually shows scientifically valid information that the medicine or the procedure or the surgery is actually what caused the improvement? So let's explore this whole idea of the scientific method.
Because when you have a disorder that is neuroplastic, from our point of view, what that means, and most chronic pain is neuroplastic, as we talked about last time, and these other symptoms, as we talked about, when you have a disorder that is neuroplastic, you don't need actually a biomedical treatment to get better because there's no physical damage in the body. So the placebo effect can be curative, can totally reverse the symptoms. And the placebo effect consists of people who get a treatment that makes sense to them. They have an explanation for it. Oh, it's your diet. Good. Change your diet. Oh, it's your chia's off. Get acupuncture.
And so
it's something else, right? So it makes sense.
Right. And so what the placebo effect is real changes, real symptoms, real improvements happening.
Right.
But it's happening because of the brain predicting or the brain expecting that's going to happen. And sometimes it does make sense. Sometimes consciously, someone says, this is great. I think that this is going to work. And so it works. But I've seen that actually it isn't necessarily consciously but it's the unconscious brain.
Yeah, people will say, I don't know, that acupuncture, that's ridiculous. I'll try it. They get a treatment, boom, they get better, as you say. So it's changing neural circuits in the brain. And placebo studies have shown that it does change neural circuits in the brain. There's changes in the brain with placebo effects. Placebo effects affect the brain, and they're powerful and they're necessary. And we use them too. I'm a placebo doctor. I help people change their brains, change their expectation of what's going to happen, and realize that they're not actually as damaged as they thought they were, which can be freeing. So
I want to really quickly say, with the scientific method, the reason we know something works is not just because there was a study done. So there's lots of studies out there where they give someone a medicine or a procedure and see if they got better. There's lots of those studies.
Exactly.
And then they say, oh, look, all these people got better. But if they didn't compare the same group, same sort of group, to getting a placebo treatment, you don't know if they got better just based on their brain's belief.
Exactly.
Or if it was actually due to that intervention. And there's a lot of information out there that looks like it's really valid, that, oh, well, look, this study showed that, but they didn't actually compare it to placebo. And that piece is critical.
And that's what happened with the toxic removal studies. And we see the same thing with, I was listening to a podcast the other day on functional medicine, where you're doing a lot of diets, supplements, herbs. And they said, 80% of our patients are getting better. And which disorders are they treating? Irritable bowel syndrome, migraine, back pain, fibromyalgia, the same sort of neuroplastic symptoms that can respond to a good placebo.
Right. And so, Howard, what is the rate of placebo response?
That's a great question.
Across the years, lots and lots of studies have been done. What's the relative rate?
Nobody can tell you that. And when I was young, they would say 30% of people respond, 30% improvement. And that's not true at all. You can have, if you compare an antidepressant, if you give people an antidepressant, 72 to 75% of people have a clinically significant improvement. But when you do the placebo arms, it's the exact same, 70 to 75% have improvement. So it's a huge placebo response. And placebo responses are higher when the intervention is more involved, when it's more expensive, when it's more invasive, actually. Surgery has a stronger placebo effect than an injection. An injection has a stronger placebo effect than a pill. So it's quite variable, and it can be very, very profound. So it can be very, very profound.
And I think sometimes people think like, oh, well, I wouldn't respond to a placebo. I mean, I'm not that kind of person. But it's not, that kind of person is being a human being.
Exactly.
Really. I don't know if I ever told you this story, but when I was in primary care full-time, my kids were really young. I think I said this in the other episode maybe, but I was getting tension headaches at 3 p.m. every day on the weekdays. And I got prescribed a preventive medicine, which is this tiny little dose. And I hadn't actually really seen it work in my patients that well. So I actually thought that it was not going to work. I was like, well, this is crazy. Fine, I'll take it because I'm getting these headaches every single day. And so I took it before bed. And the first 3 days, my headaches went away. It was the first time my headaches had been gone in 3 months.
Wow.
They came back because it was a placebo effect.
Right. But placebo can be curative. But when you see, that's what's beautiful about doing that. When we evaluate people and they have that kind of response, I would have said to you, oh, yeah, well, that shows that your headaches are neuroplastic, in fact, because they did respond.
Yeah.
In a placebo way. And we were talking earlier about a patient I had who had severe leg pain. She couldn't walk. She was really, really bad. She had been through our type of treatment that didn't really help her. And she went to Brazil and she went into the countryside where there was a shaman, big fancy, really shaman guru guy. And he had her lie on her back, pray, put her hand over her heart, look at the heavens and pray. And her symptoms completely vanished. She could walk. She was fine. And she had a long time cure. It didn't come back right away. So what about the psychological treatments?
Yeah.
Wait,
I want to ask you one quick question.
Oh, yeah.
What's wrong with taking a medicine if you get a placebo response? So if the medicine doesn't harm you, what's the problem with that?
There's not a big problem with that unless the medication has side effects, unless the medication is very expensive.
Or
and again,
that's helping. right? If it's a placebo,
it may stop working after.
Often it stops working because it's not actually getting to the root of the problem.
Right.
So,
but we're also, we're also honoring patients' preferences, what they want. People like my friend who had migraine, she wanted medication. So good, do it. If it works, great. I don't have a savior complex. I'm not going to save the whole world.
Right.
I mean, you are.
What we all want for the patients is to get better. And however people get better, awesome, amazing, love it.
Exactly.
It's just often we see that people try these things or medicine or diet or all of the, lots of different things that initially helps because of the placebo response, but then it stops helping because it's the placebo response. It's not actually changing something in the body.
Right. And many people are not really to the point where they're going to consider a mind-body type treatment without trying the other approaches.
Yeah.
And many people are so locked into the biomedical approach because, who can blame them? That's what we teach.
Yeah.
And that's what most people know. That's what most doctors practice, that they're not even interested in some of the standard psychological treatments, right? So standard psychological treatments, they would go, well, like, oh, I've got migraine. You want me to have cognitive behavioral therapy. Why? Am I crazy? Are you saying there's something wrong with me? I have migraine. And so that's another step. But we have seen many, many people, obviously, who have been to psychological therapies. And the most common standard one would be cognitive behavioral therapy.
Yeah.
The model of cognitive behavioral therapy is to help people cope better with their symptoms. In other words, that their pain or their fatigue or their anxiety and depression is biological. And we can help you cope with it by reframing, by pacing, by relaxing, by doing a variety of treatments that can be helpful. And these are good treatments. They do help people. But the research on them, getting back to that, shows that with chronic pain, the research on how effective standard cognitive behavioral therapy, which is tailored for chronic pain, is how much it lowers the actual pain level as opposed to coping with it better. It lowers the pain level by about 1/2 of 1 point on a standard 10-point scale for pain, which is not a lot.
So the cognitive behavioral therapy studies on chronic pain show a statistically significant benefit.
Exactly.
And that shows, hey, this is helpful, this is effective. But the clinical benefit or the actual response in the symptoms, how much the symptoms change, is quite small.
Exactly.
1.5 points.
1/2 of 1 point.
Oh, 1/2. Oh, geez.
Yeah, sorry.
1/2 of 1 point.
Yes.
So like my pain is 6 out of 10 and now it's 5.5 out of 10.
I mean, that's the average. So, some people will have more, some people will have no effect, but the average is that 1/2 of 1 point. And the other therapies, standard therapies, are ACT, acceptance and commitment therapy, which again starts with the premise, we're not going to help you. We're not going to help your pain go away or reverse it. We're going to help you cope with it better. And ACT also incorporates mindfulness into CBT type techniques. And then there's mindfulness-based therapies, which are also very good. And I've been a mindfulness teacher for 25 years. Everyone should learn it.
I love meditation.
Yeah, exactly. And again, you talk to the mindfulness people, they say, you ask them, does mindfulness work for pain? They say, of course. I've seen lots of people for whom they did mindfulness and their migraine got better, or their back pain got better, their IBS got better. But when you look at the research on mindfulness for chronic pain, what you see is the exact same effect as with ACT, as with CBT. So the standard psychological treatments all have some effect, but a small effect, and probably not what people really are looking for. And I would argue not what people deserve.
Yeah, right. Especially since there's these other treatment approaches that are so much more powerful for many people. Exactly. People deserve to get better if we can.
And when we think about it, and we've written about this, when we think about the differences, the main difference from our approach, which is the neuroplastic treatment approach, to the biomedical treatments or the standard psychological treatments, is we feel that we can accurately and clearly assess people to determine if they have a neuroplastic disorder or not, almost all the time. Have a neuroplastic disorder that implies that they're not physically damaged. If they're not physically damaged, then the treatment that we use, our neuroplastic treatments, are geared toward reversing chronic pain, reversing chronic fatigue, reversing chronic anxiety and depression.
Part of this approach, so talking about now this treatment that will kind of give an overview, and then in the next episode talk about more, but as opposed to some of kind of the chronic pain clinics, one of the main differences is certainly start with the assessment, have to make sure what's going on is it's structural versus non-structural. And if it's non-structural as the generator, it's neuroplastic, then we can potentially help you so that your symptoms resolve completely rather than teaching you you're going to have this forever. We can only hope to help you manage and cope with the symptoms rather than the expectation that the symptoms will go away completely. So
Exactly.
That's one of the beginning.
Exactly. And the third way that I would suggest that our neuroplastic treatment is distinct and different from the standard ones is it takes into account the role of stress, the role of emotions, and we have specific techniques for helping people deal with those, resolve those, move ahead in their lives. So we feel that it's really distinct and different. And
so it's getting to the root of why the symptom is there. Understanding psychology, what someone's brain has been through, why the survival brain is responding in the way it's responding to then create the warning signal in the body. And when you can really get down there and understand that and look at someone's life, what they've been through to prime their brain, what they're going through right now, again, understanding human psychology and really understand the reason why that person's unconscious brain is responding as if they're in danger, even though they're not, and therefore creating the warning signals in the body.
And that's why I have a prop when I see people. They've got my little brain. That's very cute, huh? I just hold it. It's kind of like my stress like thing. I squeeze it as a stress thing, but
because that little brain is
right there.
The root. That's the root of the problem.
Exactly. And guess what? We have research studies, randomized controlled trials showing that our models, the treatment models, are good, they are effective, and superior to standard models. And that is a huge thing because without that kind of research, we could just be talking in the wind,
Yeah.
Right? But we do. So we have clearly defined how to assess people. We've developed methods for that. We published on that. We've clearly defined how to educate people and talk about the brain as the predictor and generator of these symptoms. And then we have studies on pain reprocessing therapy. We have studies on emotional awareness and expression therapy. And we also put a significant emphasis in people making life changes, people treating themselves differently as well.
So Howard, talk about the study that you were involved with on chronic back pain.
Yeah, so this was a study done at the University of Colorado Boulder, Tor Wager's lab, a brilliant neuroscientist, where we had fMRI as part of the study. Yoni Ashar ran the study, a brilliant young psychologist and neuroscientist. He's so smart. And I did the evaluations for the study. We crowdfunded the study. It was funded through the ATNS, actually. Worked on gathering the money. People donated to fund this study because they thought it was so important.
And it is. It was.
It was important. It is important. And Alan Gordon was major involved in pushing it and getting it done. And he did most of the therapy sessions. Christy Weepy did a significant number as well. And it was people with low back pain in Boulder. The average age was in their 40s, so relatively young people, but they had average amount of back pain for 10 years.
Wow.
People had average.
Had back pain, chronic back pain for an average of 10 years.
Exactly. So that's a lot.
And people in their 40s. So otherwise relatively healthy.
Yeah, but otherwise relatively healthy people. And I assessed them, and 95% of them had non-structural pain. 95% of them had neuroplastic pain on the assessments that I did. And we talked about that last time. And Alan and Christy treated them using pain reprocessing therapy, which is a method of helping people to stop fearing the pain, helping people to understand that the pain is neuroplastic, helping them to move on with their lives, helping them to change their relationship to it. And it's a very powerful method. And we compared that in a randomized fashion to people who got a placebo back injection, and to another arm of the study, people who got treatment as usual, no specific treatment, which is an important control group.
Yeah. So there was 3 groups in the study.
Exactly.
One got this PRT, sort of psychological intervention. The second group got a sham injection in their back. So they got an injection, but it wasn't any medicine. And they knew it was open label, right? They told them.
Correct.
Right. So the people knew that this was a sham, which is actually there's placebo controlled trials where they tell someone it's a placebo and they actually still get better.
Yeah. Open label placebo has been as effective as not open label placebo. Anyway, in this study, and the goal of the study is to help people reverse their pain, not cope with it, right? That's the goal of PRT. And what we found was that 3/4 of the people, 75% of the people enrolled in our arm of the study had complete reversal of pain. Of 75% of those we treated had complete reversal of pain.
Wow. So 75% of the patients with pain for over 10 years had complete reversal of their pain.
Right. And these were the people we treated. There were some people who dropped out of the study, so the overall effectiveness was actually closer to 2/3 because the people who dropped out didn't get treated and we didn't count them as getting better. It's a statistical thing, but it's a huge, and it was way higher. And this results lasted for over a year. And we now have 5-year data, and that 5-year data, and that people in this arm still, for the most part, have reversal of back pain. So it's an amazing, there's never been a study that showed that result. And there's another small study from Boston, Mike Danino at Harvard did a similar study with people with low back pain, comparing, or in a randomized fashion, people who got what he calls PSRT, physiologic symptom relief therapy, which is similar to the PRT they got in the Boulder back pain study. And he compared that to mindfulness intervention, which we know is similar to CBT and ACT, as we talked about. And in Mike Danino's study, 2/3 of the people, 64%, were pain-free as well. So it's 2 different studies, both randomized, both showing dramatic reversals of pain that haven't been seen before, both in this case with low back pain. So we feel on pretty solid ground with these studies so far. And there's more. There's more coming. We have so many more studies that are in the process, but we don't have those results yet.
Yeah, and amazing. So the studies show how effective this can be, which also goes along with the thousands and thousands of people around the world who have gotten better. And these are safe techniques. This isn't a medicine, a procedure. These are self-management tools, understanding through a different perspective that it's the brain.
Yeah, and we're gathering some of this data. I mean, the place to see it is to look at the ATNS website. Is to look at the tmswiki.org website, is to look at the thankyouDrSarno.com website, where people just wrote in all of their stories that are so compelling. For my new book, I'm gathering people who just want to put their name on it. I've got almost 700 people so far. So
amazing.
There's all from all around the world. So there is an outpouring of people who've benefited, and the research is catching up. It's going to take time. It's really hard to do these kind of research studies, but we're making progress.
Awesome. Amazing.
Yeah.
Love it.
And the whole point is there's hope for recovery. There's hope for recovery.
Right.
And some people want to go the biomedical route, and some people will get better with that. Some people want to go the standard psychological route. That can help some people. Some people want to go the alternative medicine route. That can help some people. But what we're saying is there's another route. The neuroplastic route is one.
So next episode, we are going to dive down into what this treatment looks like and more details of it to understand it. So stay tuned next time.
Exactly. This is The Science Behind the Symptoms, where we explore the new science of neuroplasticity through the lens of curiosity.
Thanks for joining us, and we'll see you next time.
Take care. I'm Howard Schubiner.
And I'm Becca Kennedy.
And we're a podcast of the ATNS, the Association for the Treatment of Neuroplastic Symptoms. Take care, everybody.
Bye-bye.